gonna move into physician assistant studies. Let's see, Emily Murphy, are you here?
Yep, I'm here, Nicole. Hi.
Hi, Emily. How are you this afternoon?
Real good. How are you?
I'm good. Um, so you are the director of our residential physician assistant studies program.
Correct.
So briefly, who might be interested in a career as a physician assistant?
Yeah, so that's a pretty easy question to answer. I think anybody at this point, you don't have to have any type of specific undergraduate degree in order to become a physician assistant, which is really kind of nice because a lot of people put us in the same bucket as a nurse practitioner. And the really big difference is that you have to be a nurse before you can be a nurse practitioner. Whereas with a physician assistant, you can be someone who comes to us with a theater major or a business major or a finance major, whatever that is. Of course, science is probably the most common thing we see, but anyone with any background can come to us as long as they fulfill the prerequisites and are able to apply to the program because based on that. So it's a really nice field because it's not something you have to choose immediately. We have a lot of students who come to us from, like I said, various undergraduate backgrounds. A lot of second career people come to us as well. So we've had everyone from chiropractors to nurses to pharmacists to, like I said, we've had somebody who was really just focused on the arts, and that's what she came to us with. That was her background. Decided she wanted to get in medicine and went the physician assistant route.
Who would be a good fit for Pitt's program? Are there particular characteristics that really kind of mesh well with Pitt's PA program?
I think one of the big ones is somebody who really understands how to be an advocate for their patients. Certainly, all of us, I myself still practice as a physician assistant. And, the reason for our profession to begin with was to provide patients with more access to care, right? There was a shortage of physicians. There was a shortage of primary care providers for patients. And so, back in the 1960s, they decided, hey, let's create this new profession that can, sort of fast track train PAs to become medical providers, certainly under the supervision of a physician. But the profession has just grown immensely from there. And so I think the big one is that, somebody who really wants to be an advocate for their patients, their main focus is going to be patient care. Somebody who really wants to dig deep and see what they can do for, underserved populations, patients that are coming from low socioeconomic backgrounds, patients in rural areas that don't have enough access to care, and all of that. So those are really the people I think that fit our mission the best. But certainly, those are a lot of things that we teach. Those are a lot of things that we try to get our students involved in as they are progressing through our program. And then certainly somebody who really understands the privilege that it is to work in medicine. So, we put on our white coats in various disciplines, and a lot of patients will, come to you and tell you things about their lives that maybe they've never shared with anyone else, family, friends included. And so, students that understand what a privilege it is to see a patient at their very worst and want to be able to advocate for them and help them through that. I think those are the things that really fit with the Pitt PA mission.
Now, I get this question all the time, especially for this program. What is the best undergraduate degree for students interested in the PA program?
Yeah, and I'll kind of jump off from my prior answer. I don't have a good one for that. Because again, there are so many things that you learn throughout an undergraduate degree that I think can benefit patients moving forward, that we never put a term on what undergraduate degree would be best, because I think that there are so many routes for students to take nowadays and incorporate different pieces into their undergraduate degree that I would never sit here and be like, well, you need a bachelor's in biology. In saying that, it is a very science-focused discipline. It's very similar to someone applying to medical school. And so if it feels better for them to get a science-based major because a lot of the prerequisites fit into that for them very easily, or that is just what their passion is already, then, that is what we see most commonly. I will say that that is something I can very easily say that if you ask me what the most common major is, it's going to be something science. It's a biology, and certainly there's a lot of things that come underneath that umbrella, right? Neuroscience, neurobiology, behavioral sciences, anatomy, and those kinds of things. So that is definitely most common, but there really is no right answer to what undergraduate degree prepares them the most, because they still have to complete all of those science prerequisites no matter what. And where we see the success then, of course, is what they've done in their undergraduate degree and how they have been able to incorporate those prerequisites into it. But we certainly have a lot of students who complete their undergraduate degree and then take those prerequisites separately during, whether it's a gap year or it's something that they're doing because they're going to come back as a second career student, or something like that. And so that's all fine too. So there's really not a good answer for which one is the best fit. A most common fit, you're going to see, something similar to a pre-PA track, a pre-med track, a biology. Those kinds of things are definitely the ones that we see most commonly.
And students need, my other FAQ for the program, students need 500 hours of direct patient care experience. Is there a point when they should start? Can you start too early? And is there value in earning 2,000 hours? Do you get extra, you get bonus points on the application for having earned 2,000 hours versus the 500?
Sure. Yeah, good questions. So no, I would say that it's never too early to start. We have, I almost said patients. We have applicants who, start even in their high school career, right? They're starting to think about these things. Certainly we have the guaranteed admission program. So, you have some high school students that are starting to think about this. I think that it's never too early to start. And we value all of that experience that they have over all of those years. To answer the second part of your question, the 500 hours are a checkoff. So there are no bonus points, or anything like that. You need the 500 hours. We see that they're there. We check them off that they've been completed. But you are not seen any differently than somebody who has, 20,000 hours because they're coming back to us as a second career, chiropractor or something like that, right? And so we don't use that as a weighted tool in the application process. Where we'll see those things kind of highlighted are in their personal statements that they submit to us, or during the interview process where they can actually speak a lot about what they've done. And so that's where they can really highlight those different experiences that they've had, whether it's multiple experiences or whether it's, thousands of hours at one particular position. And, certainly we take people who, have multiple different ways of accumulating those hours, volunteer work, paid work, internships and service projects and all that kind of stuff. And so there's a lot of ways to get them. And so we value all of that experience equally.
Now, this is, a look at the PA applications, and you told us a little bit about, how you get from that 570 number to that 60. Talk me through the application timeline. When should a student try to get their application in? Is there an advantage to applying early?
Sure. So the first answer to that is yes, there's absolutely a benefit to applying early. And any student or applicant who meets with me, and probably most of anyone in our department really, to say, what should I do? When that application cycle opens, which is typically third to fourth week of April for the PA program through the CASPA system, you should be ready to hit that submit button. You should be ready to go because we do have rolling admissions. We typically have 4 interview days, and I can say that, a lot of times we're able to, fill out, a third of our class after the first 2. So we really have, very, very qualified applicants. And so that process can be pretty quick. So I would say that the earlier, the better. In saying that, sometimes people will ask, well, what if I have a course pending? I'm taking something over the summer semester, or I am still working on getting a few more of my patient care hours. That's okay. We've actually accepted students who have had those types of things outstanding, in a limited way. And certainly their acceptance is conditional that they would be completed. But we have no problem inviting people for interviews and like I said, even accepting them into the program, knowing that they will, eventually have that finished before our deadline. Like I said, late April is when that application cycle opens. And so they should be able to hit submit on that application. And the big thing is the CASPA system, that central application system that we use, it takes them a while to verify the application itself before it actually gets to us. And that's why I say the earlier the better for that, because it is still a couple of week window for the application system to review that as well. So since we are a January start date, our application window is very small. It's very narrow. It opens in late April and it ends November 1st for us. And so, that's a pretty small window to be able to collect applications, review them, get everybody interviewed and do all of that, because those are the students that will be matriculated to start that January. So we're not working a year in advance. We're working a couple of months in advance for that. And so that's something that, again, you want to be able to hit that submit button as quickly as you can because of that very shortened window. And so we do advise any applicant that, you should go ahead and proceed with that. Like I said, even if there's very minuscule outstanding requirements, that's okay. We can see that they're in progress in CASPA. We can see that the applicants have put that in there and they have a plan to have it completed by the deadline. And so, yeah, the benefit is definitely there. We typically interview in July, October, and November. And then, we have our class full and ready to go, pending any, late withdrawals or anything, typically before the holiday winter break at the university.
So for everyone in the room, stay tuned, because the hybrid program has a different application cycle and we're going to get there pretty quickly. So you might want to hear how the residential and hybrid programs do differ here. And now my last question for you, Emily, what specialties are your alumni moving into? Do you see any trends with maybe the specialties and, the types of practices that they're working in?
Sure. Yeah. Another really good question, and another question I don't have a super specific answer for, which is actually, I think, one of the highlights of becoming a physician assistant is the just enormous amount of opportunities you have and where you can practice and what you can do. And it's actually one of the things that drew me to the profession. You think about a medical student who graduates, who goes on to a residency, who becomes a neurosurgeon, right? For that person, that physician, to then go work in another specialty, they would have to do another residency to do that. I myself, since I've been a PA, have worked in neurosurgery, radiology, pulmonology, and I work in addiction medicine now. I did not have to go back to school. I did not have to take another test. I did not have to do anything. And so that is really what I think is such a special part about the profession, is that it doesn't put you in a place that you have to stay in forever. You're able to sort of move around. Additionally, I've worked strictly inpatient, where I never worked anywhere but in the hospital. I've worked in an outpatient clinic and never went back into the hospital. I've worked only in the operating room, and so again, that just highlights all of the flexibility within the profession, all of the movement within the profession, which again, I think is something that really, makes my profession, the physician assistant profession, really stand, alone in that, because it does not, force you into one specialty for the rest of your career, really. And so, in saying that, we have graduates in everything. I mean, it sometimes amazes me whenever my grads, reach out to us and say, hey, I want to become a clinical preceptor for your students. I'm working, here in this specialty. And sometimes it's in things that I didn't even know, existed. We have students and graduates who work in everything from, orthopedic surgery to pediatric hematology. I even have a graduate who, not only does she work in pediatric hematology, which, is blood disorders, but she works strictly with sickle cell anemia, and that's it. And so, you can become as specific and as, detailed into a specialty as you want to become, or you could work in a, family medicine practice where you're seeing everything, all ages, all the time. Right. And so I think those are really kind of special highlights about the profession that certainly drew me to it.
Are there any questions for Emily about the physician assistant residential program? okay, I don't hear anything. If anything comes up, always, of course, email us, reach out. We are happy to route questions to the right people if we don't know the answers ourselves.